We really appreciate you being here. We do this every Tuesday at 12:30, and we always have an exciting guest. David, he has put together for us today some information about sunscreen and about protecting yourself from the sun. And so I was commenting a moment ago. This is sort of the yin to the yang of Sherry Kiker's presentation a few weeks ago, but both things are important. So I'm really glad we're going to get an opportunity to hear that. Before we get into that, today I'd like to have a couple of give a couple of updates, and I'm going to call on Michelle right now, who is our clinical director of the assessment 10-star assessment and stabilization teams for the state. And so we've been actively working and trying to put this program together. Michelle, what, for a year and a half, I guess we've been working at this.
I think we're more than 2 years now.
Going on 2 years. Okay. So time flies when you're having fun, you know. And so I wanted to see if you could maybe just give us a little bit of an update. It might be helpful to everybody here if you just gave a quick explanation of what it is to make sure everybody knows what we're talking about, and then tell us a little bit about where we are in the process of getting the program up and running.
Sure. So I'm also going to share my screen so that you can see our website while I give this update. So the Tennessee Start Assessment Stabilization Teams is a brand new statewide program that you've probably heard us talk about here several times. So it is a resource for individuals with IDD and co-occurring behavioral and mental health needs. It's going to entail crisis prevention, crisis response, and stabilization. We are actually in the process of, well, we have drafted our phased rollout for this program. We have a lot of information on our 10-Start AST website as well, which I'm showing you here on the screen. But as far as updates where we are with everything, we currently have 19 staff hired and on board and starting and going through some very extensive training I'm sure they will attest to. Several of those staff are on with us today on CCN. We just finished, as of yesterday, hiring 4 additional staff. So that'll only leave us 2 positions to fill statewide, which is pretty good considering that we had 26 to fill in total. So we are going to be reposting, just if you know anybody, we're going to be reposting our assessment stabilization manager position for the Chattanooga region and one of our assessment stabilization facilitator positions for the Jackson region. So if you know anybody who's interested or might be a good fit there, let them know. That's going to be coming out and being reposted again. So as you can see here, our 10-Start AST website has quite a bit of information. We have some information about what 10-Start is, so I highly encourage you to visit if you haven't and read about the program itself. And then I update the news section periodically just to kind of let people know where we are in terms of rolling this out. And I'll also plug on 5/11, so on May 11th, we are actually going to have the entire 10-Start AST team on CCN. They're going to introduce themselves, tell you a little bit about their background, and we will do that for all 5 regions across the state. And then I'll also be sharing our phased rollout plan at that point. We're going to be having our next advisory council meeting for 10-Start on the 26th of April and getting feedback on that phased rollout plan. So once we finalize that, should be completed by that 5/11 CCN episode. So definitely tune in to that episode so that you can meet the team and learn what we're doing. And we'll go over, I'm sure, an overview at that point again of what the program is in a little more detail and talk about when we're going to start accepting referrals. So we're getting close and it's all very exciting. But I just really encourage you. We've got, like I said, a lot of information on the website about what it is. If you're interested in what our regions are statewide, as I said, we have full coverage here. You can visit the contact and referral section. And that lays out all of our regions across the state. And then I will as soon as we get phone numbers for everybody, I'll be putting in pictures and contact information for all of the team we have on board so far. We'll pop this into the chat box so you guys can visit that website if you haven't already, but that is what I have for the update for 10 Start.
Michelle, you've been doing an outstanding job of leading this program, and I'm really proud of all the people that we've been able to hire to do this. We've got a number of really great people that have joined in with us on this project, assessment stabilization facilitators, assessment stabilization managers, and I'm really glad that you're reserving that time on May 11th to introduce everyone, because it's good. This is going to be a really important program. And what I mean by that, everybody's important. I don't want to, imply that this is more important than other things that are going on out there. But this is something that we hope is going to kind of bring people together a little bit more to organize around how we respond to people who are having these frequent crises, and to hopefully start to reduce those over the course of time, and to reduce the need for hospitalization for people, it's not so much about reducing hospitalizations, but right sizing them. That's the key, because we want to be sure that people are getting the services they need when they need them, but not when they don't need them, when something else might work better. So I'm really, really proud of all the work that you've done. Could you talk just a little bit about how we're going to stage in the referral process, and maybe just first couple of phases of that referral process?
Yeah, so initially we are looking at opening up the referrals to individuals over the age of 6, currently enrolled in the 1915C or ECF Medicaid waiver services. We're going to start with very small caseloads. So we've got all of our coordinators or facilitators, depending on which terminology you use. START has language and we have language, a little different. But anyway, our facilitators are going to be heavily involved in training, and the way that START trains their coordinators is an apprenticeship model. So we are going to get them a good foundation in their training, and then we're going to start taking some referrals and build small caseloads. So 2 to 3 individuals per facilitator will be the caseload size that we kind of start out with, just to get a really good foundation and an understanding of the model and get our feet underneath us. And then we'll slowly start to increase those caseloads. We'll be on call for anyone who is on a 10 Start caseload. If they have a crisis event or an emerging crisis event, hopefully will be more of the calls that we have, so we can step in and prevent things from escalating. So that'll be our first phase. And then once we move into the second phase, we're going to open it up to individuals currently enrolled in all the other Medicaid waivers that I didn't mention. So ICF, Katie Beckett, that sort of thing. And we're going to maintain that on-call status for any individuals there. So we'll be slowly ramping up those caseloads at that point. And then there are other phases beyond that, but we will share more detailed information and the actual visual of the phased rollout on May 11th on CCN.
That's outstanding. Thank you so much. And thank you all of the assessment stabilization team members. This is just, really exciting where we're headed with this. I wanted to take just a minute also and share a little bit of data with you on what has happened with the COVID crisis. We're starting to, I feel like everybody's kind of moved on a little bit from this, and there's good reason that we're starting to feel more hopeful, especially in our population, the IDD population. As you know, Tennessee was the first state to prioritize people with intellectual and developmental disabilities to get vaccinated. And as with these data that I'm going to share with you here in a moment, you're going to see why that was so important to have happen. And so I'm going to make this attempt again to share my screen and to see if I can get this table up for you so that you can see. Let's see, I'm going to share my browser. That's what I need to do. And if I can get on the right page of my browser. Tell you what, you end up with a toolbar that gets in your way. There we go. Can folks see that table there?
Yeah, we can see it.
Okay. So this was this information was updated on March the 31st. And so I'm gonna go through a few dates for you just so you kind of understand what I'm putting out here. But the date of the first intellectual and developmental disability vaccinations was on December the 22nd. Probably most of the people on that date that started getting vaccinated were being vaccinated with the Moderna vaccine, which requires a second shot 4 weeks later. Some people were probably a little bit later than that, starting to get not too much after that, but shortly after that, getting the Pfizer vaccine, which is a 3-week delay between vaccinations. Both require 2 vaccinations. So the first full date that people with IDD could have been fully vaccinated was January the 25th of 2021. The first full date that people could have been fully vaccinated. So when you say fully vaccinated, you're talking about people who got both vaccinations and then they're 2 weeks beyond that second vaccination. So that's how these dates were calculated. So the Moderna date of full vaccination for those who got it on that very first day would have been February the 2nd. Now, everybody didn't get it on the first day. So, you have to take a little bit of this into account as you're looking at those data. But those just give you some markers about when you might have expected that people would have been fully vaccinated. The date of the last COVID-19 death for DIDD, so those who are reporting their information to us, that includes everybody in the ECF program, that includes everybody in the DIDD waiver programs. The last death we had was on April the 1st. It was actually reported on April the 1st. We're not exactly sure when it occurred. The person that died on that date was sick on January 31st, though. That's when his positive test was reported to us. And so he had been sick for some time before he died, and he was not a person who was able to receive the vaccine. Before that, the last death that we had in DIDD services was on January the 31st. So we have had a good 2 months here of low rate of deaths, and you'll see just how low in comparison to our baseline we had in just a moment. I've calculated a little bit of data here about the average age of DIDD persons dying from COVID-19. It was 61.51. That's slightly lower age than the typical population. It's to be expected because we have so many more people in IDD services who have significant vulnerabilities, health problems that might cause that. The range of age was 21 to 93. When you look at hospitalizations, the most amazing thing here that I want to say about that is that, first of all, I'll say these are people who survived. So anybody who died was included in the foregoing table, part of the table called a row. But in this, on this row, we're talking about people who were hospitalized and survived. And so the average age of survivors was 54.4, still a little bit of an elevated age that even had to be hospitalized, but yet that was the average age of the survivors. The range of age, this was what was interesting to me. The range of age of people who were hospitalized was 15 to 92. So we had a 92-year-old within our system who was hospitalized and survived COVID-19. I don't always want to indicate that somebody who was hospitalized had a great outcome from all of this, because a lot of people who had a severe illness may continue to have some lifelong consequences of that. So it's just as important that we're trying to prevent those circumstances that require hospitalization as it is to prevent other aspects of that, to prevent death. So that is just something important to keep in mind. Zip on down here now and show you the data for hospitalizations. Let me go down to hospitalizations first. And so what I have here in this first column is the number of hospitalizations. So I calculate everything based on a population of 12,500. That's about how many people we thought were reported to us. It may be a little bit less than that, actually, but if that's the case, it would make these numbers even more dramatic in comparison to the typical population. So when you look at how we kind of started getting ramped up here in July with hospitalizations, we got up to 25, came down a little bit toward the fall, and then in October, we still remained fairly low, but then November, we really took off. And November, December, and January were some very difficult months for people with intellectual and developmental disabilities. If you look at our numbers in comparison to the typical population, look at November. We had 33 per 12,500 for our entire population. The average per 12,500 for the typical population was 3.23 hospitalizations. That's over 10 times as many hospitalizations for people with IDD. And then you see still very dramatic numbers through January. And then starting in February, though, they really went down. And we still had more hospitalizations in February and March than the typical population, but not nearly by the same proportion as we did earlier than that. Same phenomenon occurred with respect to deaths. And you can see that January was a brutal month for deaths as it relates to people with IDD. We had 17 deaths. We were at a rate that was probably 3.5 times as many as the typical population during January, but 0 February, 0 March. Now, can I attribute all of that to the vaccines and us getting them early? No, because everybody didn't even get them during that period that I described earlier. So I don't want to imply that that means the vaccines were responsible for all of that. And you can see that the typical population was trending down at the same time. But when you look at the fact that, and in this last column, it tells the cumulative times more likely people with IDD were to die from COVID-19 than the typical person. I mean, we were up as high as 5.18 times as likely to die from COVID-19 as the typical population early on. Even later, we were at least 3 times as likely to die from COVID-19 as the typical population. And now we reach a point where we're having 0 deaths while the typical population continues to have deaths related to COVID-19. So just good reason to feel good about what we've done, where we've gone. David, you've been instrumental in this process, helping us get vaccines into arms here in Nashville, Memphis, and in East Tennessee, in Greenville. So it's been a long ride here, but this is the dividend that pays off when you do that.
Well, and that was certainly due to a lot of your hard work, just getting our population, making them a priority for vaccination. And I know you worked really hard on that, and it definitely has paid off.
Yeah, I think it was critical given the fact that we actually had nursing home level rates of death in our population and rates of hospitalization in our population in comparison to the typical population that made it necessary for us to be a priority. So that is, I think that was a really good thing, and I appreciate all your help with that. And I appreciate you being here today to present this information about the sun and it's how to manage that. I guess that's the right way to say that, maybe, David, is how to manage it. Now I've got to drop off here in about 4 minutes, so Michelle's going to take over the interviewing for me at that point, and anybody else who wants to ask questions out there. So but I'm going to go ahead now, David, and turn it over to you and let you introduce yourself to start, and don't forget to give us that interesting fact about yourself.
Well, good afternoon, everybody. I'm David Taylor. I'm the Director of Nursing, and welcome to CCN today. Honestly, as an interesting fact, I think most of you have probably heard anything that is interesting about me. I have put put us up a little beach scene behind us because I just came back from California and had a really nice visit with my oldest son. He lives in Brentwood, and we stayed in Santa Monica, which is about 4 miles down the road, and really had just an awesome vacation there on the beach and the Santa Monica Pier, and traveled around up the coast on the Pacific Coast Highway and saw a little Malibu, and went to Venice Beach and Marina Del Rey, and then a lot of the Hollywood sites, and it was just a wonderful trip. So that's my unusual thing for me is taking a vacation to California this week. But that also brought up the whole thought of sun protection. And as we came in late last night, but it seemed like the weather has been fairly good here too, and it's certainly fairly sunny outside today from my vantage point. And it just made me think about how much we need to protect people whenever they go out, and protect them from the sun. And many of you may or may not remember, but I'm going to see if I can share a little PowerPoint here. And hopefully y'all can see that. Michelle, are we up?
Yep.
Good. This is an open line entry from August 31st, 2012, where they no longer required a prescription or an order for sunscreen, and you didn't have to be a nurse or med certified to apply it. So I know a lot of people, even though this has been in place a long time, a lot of people may not be aware of that. And so y'all can get sunscreen over the counter and apply according to the manufacturer's recommendations on that product. And let's keep everybody, let's protect them from the sun. Some of the sun safety tips that the CDC had just some nice short and sweet little tips that I thought I would just go over. And it says sun safety: ultraviolet rays can damage you in as little as 15 minutes. And oh boy, I mean, how many of y'all have had a significant sunburn? Oh, it's just miserable. It blisters and peels and hurts and itches and everything, can make you quite miserable.
I've even had sun poisoning. I mean, it made me
Absolutely.
lightheaded and dizzy and nauseous. So, I mean, there's lots of bad effects if you don't plan accordingly.
There really is. So they've got a little link here to the U.S. Environmental Protection Agency's, the EPA, the UV index, external icon, I guess is what it is, predicts UV radiation levels on a 0 to 11 plus scale. The higher levels indicate a higher risk of overexposure to UV rays. And there's a tool to check the UV index external icon in your area. I'd click on this and show you, but it really didn't. You would have have to be specific for kind of a specific area and the time of day and that kind of thing. But it's interesting to look at it and kind of give you an idea. And it kind of goes along the lines with, let's go out a little more in the early morning before it gets just beaming hot outside, and wear clothes to protect and hats and sunscreen to keep everybody safe. Let's see, talking about shade. You can reduce your risk of the skin damage and skin cancer by seeking shade under an umbrella, tree, or other shelter before you need relief from the sun. Your best bet to protect your skin is use sunscreen or wear protective clothing when you're outside, even when you're in the shade. And talking about clothing, when possible, long sleeve shirts and long pants and skirts can provide protection from UV rays. There are clothes that are specifically made from tightly woven fabrics that offer the best protection. A wet t-shirt offers much less UV protection than a dry one, and dark colors may offer more protection than light ones. Some clothing certified under international standards comes with information on its ultraviolet protection factor. If wearing this type of clothing isn't practical, at least try to wear a t-shirt or a beach cover-up And keep in mind that a typical t-shirt has an SPF rating lower than 15, so use other types of protection as well. A hat. For the most protection, wear a hat with a brim all the way around that shades your face, ears, and the back of your neck. A tightly woven fabric such as a canvas works best to protect your skin from UV rays. Avoid straw hats with holes that let sunlight through. A darker hat may offer more UV protection. If you wear a baseball cap, you should also protect your ears and the back of your neck by wearing clothes that covers those areas. Using a broad spectrum sunscreen with SPF 15 or higher, or by staying in the shade. One thing about hats was I have there's a nurse in the East region. Many of you may know him. His name's Dan Freeberg, and he skis and snowboards a lot, and he knows a lot of people that have developed skin cancers on their ears and their nose and their face from their exposure when they're out skiing in the wintertime. So those you just need to protect from those UV rays whenever you're out. Sunglasses can protect your eyes and reduce your risk of cataracts, and they protect the tender skin around your eyes from sun exposures. Glasses that block both UVA and UVB rays offer the best protection. Most sunglasses sold in the United States, regardless of cost, meet this standard. Wraparound sunglasses work best because they block UV rays from sneaking in from the side. And sunscreen. Put on a broad spectrum.
Or you'll have a really cool sunglasses tan line.
Yeah, there you go.
Promoting the next slide.
That's true. Put on broad spectrum sunscreen with SPF 15 or higher before you go outside, even on slightly cloudy or cool days. Don't forget to put a thick layer on all your parts of exposed skin. Get help for hard to reach places like your back, and remember sunscreen works best when combined with other options to prevent UV damage. How sunscreen works.
I was going to add, David, one thing, as a fair-skinned person myself who burns easily, one thing that's really helpful for me for preventing sun issues are rash guards. I don't know if you guys are familiar with those, but you can wear them. It's what surfers wear. So it's kind of like a long sleeve shirt. They have pants as well for rash guards, but they're thin, almost swimsuit material, and you wear it over the top of your bathing suit, and it prevents you having to put sunblock on everywhere. So,
wow.
So you only have to sunscreen the exposed places, and it's really helpful to me to prevent me from burning, because I'm not a huge fan of sunscreen, even though it's effective. It saves me a little time and application by wearing those rash guards. So definitely look into those if you want to.
We started buying the spray on sunscreen just because it's so much easier to apply and quicker. So
yeah, and they have a lot of good sunscreens out there too, where it sprays on a different color, but then it dries clear, so you can really see that you've covered all the areas you need to, because that's one of the concerns I think some people have with the spray is, did I get everything?
Let's see, just quick on how sunscreen works. Most sunscreen products work by absorbing, reflecting, or scattering sunlight. They contain chemicals that interact with the skin to protect it from UV rays. All products do not have the same ingredients. If your skin reacts badly to one product, try another one or call a doctor. And an SPF. Sunscreens are assigned a sun protection factor, SPF, number that rates their effectiveness in blocking UV rays. Higher numbers indicate more protection. You should use a broad spectrum sunscreen with SPF 15 or higher. And then on...
Hey, David, I have a question. I don't know if you have the answer to it. So I've heard that really anything of an SPF over 30 is not really much more effective. Is that true in your experience?
I honestly don't know.
Something we should do some research on, because I'm very curious. I mean, I don't know if it's just a rumor or if it's real. I always try to go for 30, because once you get into like SPF 50, it's basically like slathering oil all over yourself.
Yes.
It just gets really greasy and.
Well, it's just interesting. Everything I read for this, just gathering this little bit of information, but I checked several sources just to make sure they were all consistent, and everything referenced 15. So 15 or greater. So I guess it may depend on, I wonder if the higher SPF ratings don't have to be reapplied as often. I don't know. You would think it would probably still wash off and wear off equally as much, unless there's something in them that makes it last longer. But
yeah, I mean, there's definitely a lot of varieties of sunscreen out there these days, but you can pay attention to if you're going to be exercising. There's sport sunscreens out there that help with it not coming off as quickly when you're sweating. Some are more waterproof than others. Some are just for daily. There's a lot of lotions that have that SPF 15 built in, especially face lotions. So you can kind of look for those as you're thinking about just your daily routine, lotion that you may put on. It's just a good thing to look for on the bottle. Chapstick also has SPF 15 often if you check for that.
that's good because your lips can really get dried out and blistered quickly in the sun. One thing we wanted to mention here about expiration dates on sunscreen. It says to check the sunscreen's expiration date. Sunscreen without an expiration date has a shelf life of no more than 3 years, but its shelf life is shorter if it has been exposed to high temperatures. So I was reading a little bit about this from the FDA, and if they have certain ingredients, the manufacturers have to put an expiration date on it. But some products don't require an expiration date, and if you just happen to be using one of those products, then that doesn't have an expiration date, then it needs to be no older than 3 years old. And I would think a lot of people may store sunscreen in their car, in the event that they're out and about and need it. So be mindful of that if it has a shorter life.
Also be mindful of it exploding in your car if it doesn't have the right cap on it. It's in high temperatures, it happens.
Look at our time. We still
My
got a little bit.
sunscreens are inevitably, every time I have a use for my sunscreen, if I'm going to be out for a long period of time, always expired. Always buying new sunscreen. I swear they only last, like six months to a year, maybe, the ones I buy, but I feel like mine are always expired.
My wife ordered some for a trip and through Amazon, and of course it came the next day, and it was a aerosol spray and couldn't take it on the plane. So they'll actually take it out of your suitcase if you have an aerosol container in your luggage. So that's kind of a pain, but we ended up buying some when we got out there.
Yeah.
I found a couple of other just very short tips on sunscreen, and I thought I would try to play these. So I'm going to try to share this again and see if I can play these so everyone can hear it. And I'm thinking this will be share the browser. Here we go. Let's see if y'all can. Oh, that's a little quiz we have to follow here in a minute. See if y'all will be able to hear this. Can you hear it?
No, but I may do it on my end, David. I might have a better shot at it instead of having to walk you through. Let me see if I can pull it up on my side.
Okay.
Got to stop it from playing first because it's already launching in there. All right, let's see. I need to share.
Michelle, I'll send you that email that I sent Dr. Davis earlier, that it's got the links to the other two things on it.
Okay. I've got to optimize for motion and video first. That's what I forgot. Okay. Can you guys see the screen okay?
Yes, I can.
All right. We'll try it. Let me see. Let me know if you can't hear.
Okay. Got it. Yeah, good.
Hi, I'm Janet Woodcock, Director of the Center for Drug Evaluation and Research at the FDA. I want to talk to you about products many Americans use every day, sunscreens. We all rely on sunscreens to help prevent sunburn and to reduce the risk of skin cancer and early skin aging caused by the sun. We all can see the differences between parts of our skin that have been sun exposed and those that have not. Sunscreens are regulated by the FDA to make sure they work and are safe. We recently asked sunscreen companies to give us additional safety information about sunscreen ingredients. We're asking because sunscreens are used a lot more now, often daily instead of just at the pool or on vacation. And scientific knowledge and technology have improved our ability to look at safety issues since sunscreens were first marketed. For example, we're closely evaluating the safety of each ingredient. We're also reviewing the sun protection factor, or SPF, to determine if current sunscreen products give enough sun protection. We're also looking at ways to update the labels to help you make good decisions about the sunscreens you use. Asking sunscreen companies for more information does not mean that sunscreens are unsafe. It also does not mean that FDA is taking sunscreens off the market. We requested information because the FDA wants to improve the overall quality, safety, and effectiveness of sunscreens that Americans use. We recognize the benefits of using sunscreens. I use them daily. I urge you and your family to use them. Both the FDA and the CDC recommend using a broad-spectrum sunscreen, which means it protects you from UVA and UVB sun rays. It should also have an SPF value of 15 or more if you plan to go outside. But remember to take additional steps to protect your skin. Stay out of the sun at peak times, seek shade, and wear protective clothing, hats, and sunglasses. We're committed to doing our part to help improve the quality, safety, and effectiveness of sunscreens. For more information about sunscreens and sunscreen ingredients, go to www.fda.gov/sunscreen. Thank you.
Michelle, I'm not sure how long that other one is, but if we don't have enough time to play that other one, we certainly, what would be interesting is that little quiz from the FDA, I believe, that they had about sunscreens. I thought that was quite interesting. Thought might share that with everyone.
Let me unmute myself so you can hear me. Are you wanting to do the CDC Sun Safety? Is that the other one you're talking about?
If we have enough time, I'd play that one real quick too. I think it's relatively short also.
Get to it. Okay, I see what you're talking about. Video and
thanks for your wonderful help with this, because I probably would not have figured out how to do that.
Yeah, no problem. You're talking about this video, correct?
Yes, yes.
There's supposed to be sound because there's not any on my end.
I don't hear any. I had the same problem earlier. I think this just may be, there's supposed to be sound, but it's not. For those that can't see this, it's a little bit challenging, I'm sure. So we can just go ahead and stop this, Michelle, and we'll just move to that the little quiz if you can.
Yeah, I don't think that video actually has any sound, so it wasn't our side.
I couldn't hear it earlier, and I was thinking it was probably just me. So I was hoping that it would play, but.
So it looks like we're taking this quiz.
Yeah.
Maybe we
Let's
could do
get
an
started
audience
with the
poll.
quiz.
Audience members, you can respond with your answers in the chat box. You want to read the questions?
Right. Yeah, sure. The first question is, how often should you reapply sunscreen when you're outside? A, at least every hour, B, at least every 2 hours, C, at least every 4 hours, D, don't need to reapply, and E, only need to reapply after sweating or swimming. Anybody wants to jump in with that if you think you know the answer? If
Got an
not,
A.
I'll be. Do
Give
what?
everybody, we'll give us, and we've got one person who
That's
responded
right.
with A. We
Yay!
can get a few more selections in the chat box there, and we'll answer as a group. Any others agree with A? Oh, we got a B. It's a battle.
A's and B's.
We need a
And
tiebreaker.
I'll jump in here unless there's a tiebreaker of somebody, but it's at least every 2 hours. And that was interesting to me. I was thinking it was more along the lines of 4, but it says how often should you reapply sunscreen when you're outside? At least every 2 hours. Don't always think of that after we're out and about and doing things. Question 2, a recent FDA study showed that some sunscreen ingredients are absorbed into the body. This means A, I should continue to use sunscreen as directed. Evidence of absorption doesn't mean these ingredients are unsafe. It just means that more data is needed. Or B, I should stop using sunscreen. C, I should make my own sunscreen. Or D, I should only use sunscreen conservatively, for example, only in a limited amount on a sunny day. Well, this lead is a little lead into what they were talking about in the FDA video, where FDA is looking more closely at sunscreens. And I'm going to just jump in with the answer on this one, and it is A. I should continue to use sunscreen as directed. Let's see.
You can let me know if you want me to skip this explanation underneath the correct answer.
No, this is okay, because I wanted to read this, because they were particularly about this one. I thought this was interesting because they are identifying some ingredients that are being absorbed into the body. But also use other methods to protect yourself. Wear sunglasses. Limit the time you spend in the sun, especially when the sun's UV rays are the strongest, usually between 10 a.m. and 2 p.m. Wear protective clothing and hats in fine shade. Sunscreen that is both broad spectrum and SPF 15 or above has been proven to reduce the chance of getting sunburn. Early skin aging and skin cancer. FDA has asked the industry for additional safety information on some sunscreen ingredients because scientific knowledge has evolved, and we use sunscreen more often than we did years ago. So I just think that was really interesting, and it's great that we have an FDA that looks at stuff like this for us, and kind of keeps manufacturers honest. Which of these statements is true regarding sun safety for infants? A, adults are at greater risk than infants of sunscreen side effects such as a rash. B, infants can be exposed to the sun for a limited amount of time without increased risk. C, sunscreens are not recommended for infants under 6 months of age. And D, protective clothing does not have much effect on sunscreen, and sunscreen is much better UV protection method.
Got any answers in the chat box? Anybody want to take a stab at the answer to this one? Got one C. A D. You got a tiebreaker, David?
Actually, I don't remember this answer when I went through this earlier, but I missed it before.
Now it's a gamble. We've got two C's. We're gonna go with it.
So let's see what it says here.
Oh look, C was correct. Thank
What a
you,
great
Chadwick
group.
and Cindy.
So C, the FDA recommends that infants be kept out of the sun during the hours of 10 a.m. and 2 p.m. and to use protective clothing for them if they have to be in the sun. Dress infants in lightweight long pants, long sleeve shirts, and brimmed hats that shade the neck to prevent sunburn. Infants are at greater risk than adults of sunscreen side effects, such as rash. The best protection for infants is to keep them out of the sun entirely. Ask a doctor before applying sunscreen to children under 6 months of age. And I actually remember doing this. We had sunglasses for my youngest son when he was just a newborn that we would put on him when we go out. That was pretty cool. He looked cool. So now question 4, the FDA recommends that you do not use sunscreen products that have passed their expiration date. If there is no expiration date indicated, what should you do? And A is do not use it. B, report it to the FDA. C, assume that it is stable to use if it was purchased within the last 3 years and has been stored in a cool, dry place. Or D, assume it's stable to use indefinitely. And we talked about this earlier just a bit, and the answer to that is C. It's assumed it is stable if it was purchased within the last 3 years and has been kept in a cool place.
I think you'll like it.
And number 5, we can just skip through that. So we kind of covered it a little bit earlier. Let's see, all of these are ways to reduce risk of sun damage to your body, except A, limiting your time in the sun between 10 a.m. and 2 p.m. when the sun's rays are most intense. Wearing clothing to cover skin exposed to the sun, such as long sleeve shirts, pants, sunglasses, and broad brim hats. C, using broad spectrum sunscreens with an SPF value of 15 or higher regularly as directed. And D, getting a base tan by using tanning beds or laying out in the sun.
I mean, that one's too easy.
Pretty easy on that one. I'd say
Especially after David's presentation, we should all know the answer.
Yeah, we covered all those other things. So the one thing we would not want to do is get a base tan by using tanning beds or laying out in the sun.
May happen unintentionally, but you know.
Any color change is a sign of skin damage and any skin type. That's interesting. Number 6, true or false? All sunscreens protect against sunburn, but only those that are SPF 15 or above and are broad spectrum have also been shown to reduce the risk of skin cancer and early skin aging. Any takers on a guess on that?
True or false in the chat box? You can just put T or F. I'm gonna go with true. We don't have any.
Yeah, I'm going with true too.
Got one true.
Dandy. That's correct. All sunscreens protect against the sun rays that cause sunburn, but only those that are SPF 15 or above and also broad spectrum have been shown to reduce the risk of skin cancer and early skin aging caused by the sun when used as directed. And how about number 7, true or false? If you sweat or go swimming, you need to reapply sunscreen more often than every 2 hours, even if the sunscreen is water resistant. I would just take a stab on that and say true.
I think so too, because I think even the ones that are water resistant tell you to apply it every 2 hours.
Sunscreens meeting certain criteria may be labeled as water resistant for 40 or 80 minutes, which means you need to follow the instructions in the product label to reapply more frequently than every 2 hours if you're sweating or exposed to the water. In addition, you should reapply sunscreen after towel drying because toweling off may wipe off the sunscreen from your body.
And this is precisely the reason that I use rash guards when swimming, so that I don't have to get out every 2 hours and do that. At least not everywhere. On my face, yes.
Number 8. When do the FDA and CDC recommend wearing sunscreen? A, while swimming at the beach on a sunny day. B, while playing outside on a cloudy day. C, while skiing in the winter. Or D, all of the above. I'm guessing it's going to be all of the above.
We did have one answer that agrees with you.
Yay. In general, they recommend the use of broad spectrum sunscreen with an SPF of 15 or higher, even on cloudy days. Snow sports pose particular risk of UV exposure because they are often performed at higher altitude and sunlight is reflected from the snow.
Yes, I have been burned heavily at higher elevations, even on a cloudy day.
Oh, my
Especially
son went
in
to,
Yellowstone National Park. I mean, I was toasted. I didn't even think it was going to be an issue.
my son went skiing in Aspen 2 years ago and didn't think about putting any sunscreen on and burned his face, and it just peeled and scabbed, and
Yeah,
it was
snowburn and that
miserable.
reflection, especially if you're out on a boat on the water, even if you're in the shade, the reflection off the water can burn you really bad. And it's a challenge.
Number 9, true or false? Getting a tan, whether you have lighter or darker skin, is healthy. I would say
Well, they
false on
gave
that.
us the answer to that.
Any color change is a sign of skin damage and any skin type. Sun damage to the body is caused by invisible ultraviolet radiation. Sunburn is a type of skin damage caused by the sun. Tanning is also a sign of skin reacting to potentially damaging UV radiation by producing additional pigmentation that provides it with some, but often not enough, protection against sunburn.
So opt for the spray tan is what we're saying. If you feel the need to have a darker skin tone, opt for the spray tan.
And our last question is, a sunscreen label of SPF, sun protection factor 15, means A, you can stay out of the sun 15 times longer than you stay out in the sun 15 times longer than you normally can without getting burned. B, the sunscreen lets twice as much solar radiation through as a sunscreen labeled SPF 30. C, it takes 15 times more solar energy to produce a sunburn compared to unprotected skin. And D, the SPF value tells consumers how much broad spectrum protection the sunscreen provides. And E, you can stay out in the sun for 15 hours without being burned. Since we're getting really only 1 minute of time left, let's just jump right in. And I believe the answer to that is C.
You are correct.
SPF is a measure of how much solar energy radiation is required to produce sunburn on protected skin. For example, skin that sunscreen has been applied to relative to the amount of solar energy required to produce a sunburn on unprotected skin. An SPF value increases, sunburn protection increases. It is important to remember there are other factors other than the amount of time you spend in the sun that impact the level of SPF you need. For example, the intensity of the sun, the geographic location you are in, impact the amount of solar energy you're exposed to, and also you reapply sunscreen. Also, when you reapply, you are not resetting the clock. Any sun damage that your skin has undergone remains. However, frequent reapplication of sunscreens is associated with decreased absorption of solar UV radiation. So basically, put your sunscreen on and prevent those sunburns.
That's right. Well, we
Yeah.
really appreciate the presentation and the information, David. It's a beautiful sunny day out here, so if you're going to go out and enjoy it, use the precautions we talked about today.
Right.
But we will see you all again next week on the Clinical Consultation Network. We do this every Tuesday at 12:30 Central Time. So enjoy your sunny day, and we will see you all next week.
Thanks, y'all. Have a good afternoon.
Thank you.
Thanks, Michelle.